I would like to catch up on what's going on, not only in Talbot County, but in the region. And we might as well start with what you know of in terms of the numbers and where we are in terms of our health system.
What we know thus far statewide is, as of today, there are 3,125 cases of COVID-19 across the state of Maryland. The number of deaths have gone up as we expect they would be. There are 53 deaths related to COVID-19 here in Maryland, and that's jumped up from 42 deaths reported on yesterday. Here in Talbot County, our numbers are also increasing. We have 7 COVID-19 positive tests here in Talbot County, and I am sad to report this morning that we have 1 death of COVID-19 related virus. And yesterday, the number came out that we had about 21,000 tests that were being conducted across the state. Mobile testing sites that have been used to get people tested. Of course, we have one here in the region at Chesapeake College. They have done approximately 171 tests. 172 tests as of yesterday's numbers. They did receive additional kits in from the state, so that should allow Dr. Ciatola and his group to do more testing throughout yesterday, Friday, and going into next week. So the testing site there has also seen an increase in the number of tests performed.
These are people that are going to Chesapeake College with either a note from their doctor, or you just don't drive up and.
Exactly. Yeah, you have to first be referred by your local physician, and that physician would have to fill out a medical form. That form is turned in when you get to the testing site. They'll verify the doctor's signature, and all the appropriate boxes must be completed by the physician.
Have you gotten a sense of how we're equipped for ventilators and protective gear?
As far as the PPEs, we did get a shipment in the other day at the EOC. That shipment was disseminated through our partner agencies fighting this battle with us, Dr. Wiley and Clay Stamp and Brian LaCates from our Emergency Services Department. When those shipments come in, they go through those shipments, verify that everything is there that was requested on the order. Ventilators, I do not know the count of ventilators here, either with Shore Health or with Chop Tank. I don't have those numbers, whether or not they are running short on ventilators or not. A number, by and large, most of the people who present with COVID-19 are not being hospitalized. They're not being hospitalized. They are being allowed to go home and to recover at home. Yesterday, we had about 416 hospitalizations here in Maryland. So that number compared to the 21,000 tests that were done statewide on yesterday, you can see that what percentage are actually being hospitalized and what percentage are being sent back home.
The federal government came out and made the suggestion that people wear masks at this point if they're anticipating going to the store or some other public area. I'm just wondering if you all have supported that and whether you expect the community to comply with that suggestion.
I don't think it's a bad idea. I mean, if you listen to what Dr. Anthony Fauci is saying from NIH, that it's not a bad idea to wear the mask if you have to be in public. We do know now that there are persons who are asymptomatic, meaning that they could have the virus inside of them and not show those symptoms that we just talked about earlier, the fever, the coughing, the shortness of breath. And if they're walking around in close proximity to another individual, they could actually be passing along. So wearing the mask is not a bad idea. I know the president stopped short of requesting that or mandating that. He did leave it up to the states to make that decision. I don't think it's a bad idea. I have a mask that I keep in my car, and if I have to go into a building here for groceries or for whatever reason, I'll wear the mask.
Do you have a sense of how other counties on the midshore are doing at this point?
Well, I know that Dorchester saw their first COVID case at the beginning of this week. They were the only county on the shore up until last week that was not showing any COVID positive case. That's not the case now. Every county in Maryland, all 24 jurisdictions, are now showing at least one COVID case. We did have a call. I did ask some of the midshore counties to join me on the call last week, and we just wanted to find out what we could do to help one another. And they're doing pretty much the same thing that we're doing here. They've set up their EOCs. Now, some of them last week had not issued their emergency declaration, and I think since that time, all of the counties on the shore have issued an emergency declaration. But all of the counties on the shore are moving through this together.
Is there anything else that you want to make sure that the community knows?
Follow the stay-at-home directive. Stay inside. Take care of yourself. If you feel poorly, contact your doctor right away. Most, if not all, doctors are doing telemedicine right now, so they're doing the virtual appointments with their patients. So they're allowed to see you as you and I are talking now virtually. So I would certainly recommend the mask. I would certainly recommend the gloves, and I would certainly say to our citizens, please practice your social distancing.
Wrap up. Where can you get a mask?
We don't want citizens running out and trying to purchase N95s. You probably can't purchase them right now anyway. But we want face covering. So it could be a bandana. It could be a scarf. It could be something lightweight that you can breathe through. Again, it could be a scarf. It could be a bandana. It doesn't have to be a surgical mask. It doesn't have to be the N95. You just want something that would interrupt that flow of moisture leaving your mouth into the air. And remember, if you wear it for that day, take it home, wash it thoroughly, dry it, and then you'll have it for the next day.
Thank you, Corey.
Thank you, Dave. Appreciate it.